Well, now let's go to where the rubber really meets the road. This is the first study that I got involved in back in 1985, and I had I had gotten interested in this, and you're probably asking yourself, what in the world does a general surgeon have as an interest in nutrition? It was while I was chairman of our breast cancer task force back in the late 1970s, early 80s. I found myself becoming increasingly disillusioned with the fact that for no matter how many women I was doing breast surgery, I was doing absolutely nothing for the next unsuspecting victim. This led me to do a bit of global research, and it was quite striking to find that there were multiple cultures where breast cancer rates were 30 and 40 times less frequent than in the United States. And if you were to look at rural Japan in the 1950s, breast cancer was very infrequently identified, yet as soon as the Japanese women would migrate to the United States, by the second and third generation, still pure Japanese American, they now had the same rate of breast cancer as their Caucasian counterpart. Perhaps even more powerful was looking at prostate cancer rates in Japan. In 1958, how many men in Japan had died of prostate cancer? 18. That was one of the most mind-boggling public health figure I think I've ever encountered. By 1978, 20 years later, they were up to 137, which still pales in comparison to the 28,000 who will die this year from prostate cancer in this country. Well, it was along about this time in my review that it was apparent that I was seeing multiple cultures where cardiovascular disease was virtually non-existent. And it just occurred to me that there would be more bang for the buck if we could get people to stop eating the foods that were giving them heart disease, because at the same time, it was quite likely that they would diminish the likelihood of the common Western cancers of breast, prostate, colon, and perhaps even pancreatic. So that was sort of the background and how I would sort of approach and do this study. You just can't, you you can't raise the flag and say, but stop eating the foods that are killing you. You really have to do some research. That's the only way it's going to make some progress. So I knew I was committed to doing this research, but since I had grown up on an Aberdeen Angus and a dairy farm, that really was going to be hard for me to get started, because although I knew I was going to do it, I was a cholesterolholic, as it were. My father had had his first heart attack at 43. And anyway, finally, you go through, when you're thinking about making a lifestyle transition, Dr. Prochaska from Rhode Island has shown us that you go through these several stages where you go from pre-contemplation to contemplation to action and to maintenance. And I was over here somewhere around contemplation when finally I was in New Haven, Connecticut with Ann, my wife, at a medical meeting, and God, the papers were really not that exciting, and the weather was awfully rainy. But nevertheless, they always have a banquet after these meetings, and at the banquet, this waitress put a plate in front of me. And the roast beef was so enormous, it was draped over the sides. And I just was shaking my head. And Ann said, "You're not going to eat your roast beef?" I said, "No." And it was interesting. She said, "Well, then I'll have it." Well, Ann's mother had actually died of breast cancer at age 52. And 2 weeks after that meeting, her sister came down with breast cancer. And then she looked at me and said, "I'm with you." So we started our with the idea that the first thing we had to do, we had to eat ourselves this way for at least a year. And I think my cholesterol was 185 or 90 when I started. And after several months, it was 155. And I was still upset because I wanted to be better the Tarahumara Indian. And so I knew I had to stop the oil. And as soon as I stopped the oil, my cholesterol suddenly was 119. I said, I think we've got this now. So the study was started by actually my talking with Bill Sheldon, who was then the chairman of the Department of Cardiology, and he allowed me to make a presentation before his department and asked for about 24 patients, which was about the maximum that I could manage, and at the same time carry out my surgical obligations. And my late brother-in-law used to call these patients Essie's walking dead. They had failed their first or second bypass. They had failed their first or second angioplasty. They were too sick for these procedures, or they had refused. 5 were told by their expert cardiologist they wouldn't live out the year. And I'm happy to say that most of them really made it close to 20 years. Now, the question that I had doing this research is, how would I be sure to get these patients to adhere to this significant nutritional change? And for that, I used the same mantra that I used for my cancer patients that I had learned years ago from a wonderful West Coast surgeon by the name of Bert Dunphy. And Bert used to say that patients with cancer are not afraid to suffer, and patients with cancer are not afraid to die. But patients with cancer are afraid of being abandoned by their family or by their physician. So for the first 5 years, I was seeing these patients every 2 weeks in the office when I would check their blood pressure, their cholesterol. I would go over every morsel they ate. At the end of 5 years, I became more courageous and I stretched it out to once a month. Most cardiologists see their patients twice a year. Then at the end of 10 years, they were pretty well on autopilot. So I was able to stretch out to see them quarterly. And then at the end of 12 years, it was time to write this up, because this was one of the longest, if not the longest, follow-up of patients seriously ill with heart disease with this type of nutrition. Now, as you see listed on this slide, there were 23 men and 1 woman who had severe triple vessel disease. And the whole idea was to have them avoid eating anything that was going to injure their endothelial cells. So not a drop of oil, olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil in a cracker, oil in a piece of bread, oil in a salad dressing, oil in a chip, the whole idea, and also oil in a salad dressing. The idea was to eliminate oil, because oil injures endothelial cells, as does anything with a mother or a face, meat, fish, fowl, turkey, and eggs. And we wanted to avoid dairy, milk, cream, butter, cheese, ice cream, and yogurt. And avoid, it's not here, but it should be avoided, the sugar and caffeinated coffee. Now, here I want to share with you the work of Stan Hazen from our institution, looking at lecithin and carnitine, which are molecules that are found in these animal products that you see listed here that are consumed by omnivores. And what Stan found was that omnivores contain in their microbiome, in their gut, bacteria which are capable of metabolizing lecithin and carnitine into a molecule called TMA, trimethylamine, which is rapidly oxidized by your liver to trimethylamine oxide. And it is trimethylamine oxide that injures your endothelium and injures your blood vessels. So this was really rather exciting. It was rather powerful research, and it shows why it is that persons who are eating the paleo diet or keto diet and all that animal products really are putting themselves further at risk. And here is the schematic Notice the lecithin and carnitine metabolized by gut bacteria producing TMA, which is oxidized in your liver to trimethylamine oxide, which is capable of contributing to vascular disease. However, what Sandhazen also found out that was quite powerful was that when he took somebody who was absolutely totally committed to plant-based nutrition and fed them a lamb chop and then measured their blood, no TMAO. Why? Because persons who are totally plant-based do not possess in their gut, in their microbiome, the bacteria that are capable of converting lecithin and carnitine into TMAO. Another marvelous bonus from being plant-based. So, continuing with this original group, what did they eat? They eat all these marvelous whole grains, 101 different types of legumes, lentils, and beans, all these marvelous red, yellow, and green leafy vegetables, and some fruit. Now, I should share with you that it was about a decade ago that I made a major modification in our program for patients, and I want to share that with you. The reason for making this modification was increasingly an awareness that the endothelial production of nitric oxide, which is so essential, was age dependent. You never heard of a boy or girl at age 8 having a heart attack. They have nitric oxide coming out of their ears. But by the time they're beautifully healthy at age 50, they have 50% of the nitric oxide they had when they were age 25. And by the time you're 80, you've lost 70%. So I made a modification in our program to have a greater stimulation of the endothelial production of nitric oxide, and at the same time took advantage of the newer research that was showing us that mankind had an alternate pathway for making additional nitric oxide. And here it goes. Therefore, when I have a patient with heart disease, I need them to chew, not smoothies or juicing. I need them to chew a green leafy vegetable roughly 6 times a day. After it has first been steamed 5.5 to 6 minutes, so it's nice and tender, and then they must anoint it with several drops of a delightful either rice or balsamic vinegar. Why? Because research has shown us that the acetic acid from those vinegars can restore the nitric oxide synthase enzyme contained within the endothelial cell that is responsible for making nitric oxide. So you're going to chew this alongside your breakfast cereal, again as a mid-morning snack, again with your lunch and sandwich. That's 3, mid-afternoon 4, dinner time 5, and of course I adore it when you have that evening snack of arugula or kale. Now, the second benefit that comes from chewing the green leafy vegetable, it restores the capacity of your bone marrow to once again make the endothelial progenitor cell. What do? Remember, we saw them earlier. They replace our senescent, injured, worn out endothelial cells. Now, the third benefit from chewing the green leafy vegetable, while you are chewing a green leafy vegetable, you are chewing a green nitrate. As you chew the green nitrate, it is going to mix with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue. Those bacteria are going to reduce the green nitrate you are chewing to a nitrite. When you swallow the nitrite, it is now your own gastric acid, which is going to further reduce the nitrite to more nitric oxide, which can enter your nitric oxide pool. So think about it. With absolutely minimal expense, no hideous side effects, all day long, you are absolutely, from dawn to dusk, morning to night, you are absolutely restoring nitric oxide, the very molecule, the deficiency of which gave you this disease in the first place. Now, there's a caveat to this. Toothpaste with fluoride. Public drinking water with fluoride and mouthwash will injure the beneficial bacteria in your mouth. And I do not like antacids because antacids will decrease your gastric acidity, and you will be unable to reduce the nitrite to more nitric oxide. Now, the top 6 are kale, Swiss chard, spinach, arugula, beet greens, and beets. And if you want to know the whole list, it would go bok choy, Swiss chard, kale, collards, collard green, beet greens, mustard green, turnip greens, snapper cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, parsley, spinach, and arugula and asparagus. And the reason I do that is because I want you to know how important whole food plant-based nutrition is for your memory.